Hi, today we're going to do positioning, bed positioning. This is Holly, and she's going to be our patient. The very first one we're going to do is supine, and that's when somebody's laying on their back and their face is up. To position them correctly, you're going to want to take a pillow, and you're going to want to make sure their heels are up off the bed. Remember, heels that are on the bed or the mattress can have pressure ulcers developed in a very, very short time. So we're going to pick up those legs, and we can either float the heels this way, making sure there's room right underneath there. Holly, is that comfortable?
Yes.
Okay, so that's good. That would be a good way. If we needed to position our arms because of swelling or something like that, of course we could do that. But we just have to ask her, is that comfortable? Okay. We could do it on the other side too if we needed. Just lift the arm up. And that's exactly how you would do supine positioning. Right from supine, we can take these two pillows out. Go ahead and leave the heels floated so they're up off the mattress, and we can go into Fowler's position. Fowler's position is the second one. Fowler's is when the head of the bed is up. It can be as simple as 5–10 degrees or as far as 90 degrees. And it all depends on what the order is, what you're trying to do with the resident when you're feeding them or brushing their teeth. You're going to want to make sure they're at 60 to 90 degrees. If it's just for comfort, that's not too comfortable, is it? You tell me when, okay?
That's good.
Okay, and that's probably about 60 degrees, wouldn't you say? So that's another, Fowler's can go from 5 degrees to 90 degrees, whatever's comfortable for the resident or whatever the order says because of the task or what's going on diagnosis-wise for the resident. The next one we're going to do is prone. Now prone is on your stomach. Most of our elderly people can't be put on their stomach, but on occasion you might come across someone or someone younger that does like to lie on their belly. So we're going to practice that. Got the bed down, okay? Sure, the call lights out of the way. We're going to take this pillow out, just so we can help you. Holly, can you help me move towards me? So, because we're going to roll over. Yep, there you go. There you go. Okay. We're going to cross this leg. We're going to pick this arm up and cross it. And on the count of 3, Holly, we're going to roll over. You're going to move back, and then you're going to go on your belly. 1, 2, 3. Good body mechanics. Yep. Okay, Holly, can you come back this way a little bit? Yep, there you go. Okay, now, to get that arm out, we're going to have to make sure the underarm is flat on the side, because when it comes out, we're going to want to make sure it's on the other side of the bed. So 1, 2, 3. We roll over. There's that arm that we were looking for. Holly, are you comfortable, or can I put that down like that?
Yep,
okay. Back is nice and straight. I'm going to ask if this is comfortable, and you just let me know. Is that comfortable,
Yes,
Holly?
it is.
Okay. Making sure that she looks nice and comfortable there, okay? Your airway's clear. That's important that we make sure that the nose and the mouth can easily breathe. Okay, now from prone, which is lying on your stomach, we're going to go to Sims. And Sims is where it's kind of like the crime scene position. Holly's head is facing that way, so we're going to go ahead and pick this arm up and put it underneath the pillow, making sure her airway is clear, because we never want. We're going to make sure that this arm is just kind of comfortable there. We're going to put that on a pillow here in a minute, and we're going to kind of turn her just a little bit. That leg goes up, making sure that there's not too much pressure on that knee. We'll pick your knee up just a little bit. There we go, Holly. Okay. We've got 1 pillow, 2 pillows, 3 pillows, and we're going to ask her if picking that arm up is comfortable. Is it, Holly?
Yes.
Okay, so that's the Sims position. Head's facing that way. This arm is raised, which that happens to be her right arm. Her right leg is raised, and this one, her left arm is down straight. Okay, and the last one is lateral. Lateral is side lying, can be either way. I'm going to help Holly get into that position. I'm gonna remove the pillows. Whenever you reposition someone, you do have to remove all the pillows because there's no way that you can fight all those pillows. So Holly, I think what we're gonna do is put this arm straight again, this leg straight again. We're gonna have you roll back over towards me. Is that gonna be okay?
Yep.
1, 2, 3. Good body mechanics. See if you can get that arm out. Yep, okay. So this is sideline. I'm gonna ask you to center yourself in the bed a little bit. Perfect. Okay, perfect. Very first one we're gonna wanna use is for the back. To do the back, it is kind of a folded pillow. We call it a hot dog one. You've kind of put a crease right there and roll that and tuck it right underneath Holly's back. Ask her to roll back a little bit and ask her if that's comfortable.
Yeah.
You can move her here just a little bit and make sure this pillow is in her shoulder area. Okay? The next one we're going to take is going to be between the top part of her legs, and we're going to make sure there's no bony prominences touching or any pressure. So we're going to go ahead and put that there. We kind of bend it a little bit. Now we want to make sure her ankles are not touching. There's 1, there's 2. So we're just going to put another pillow right there. While you're coming up here to her shoulders, take her upper arm, let it be her right hand or left. Go ahead and make sure her bottom arm is not stuck underneath. So we're just making sure it's free and that it's comfortable. Is it, Holly?
Yes.
Okay. And the last one, this pillow can either be put right underneath here for comfort, or she could bear hug it if she wanted. Is that comfortable?
Yes.
Okay, and that's considered lateral. You can do either side, right side or left side. Wanted to show you that if I took this pillow out and brought Holly back just a little bit, you can see the pressure on her hip down there has moved a little bit, so it's not a direct on the trochanter there. So lateral can have a lot of different positions, but just so bony prominences aren't touching. Important to reposition someone that can't reposition themselves every 2 hours, making sure that we're watching all bony prominences.